Hi, my name is Rebecca Lehman. I grew up in Vermont for the most part, and I work as a certified nurse midwife for Women Specialists of New Mexico, which is based in Albuquerque, New Mexico. So, for 2 days of the week, I work in a clinic where I see pregnant women for prenatal care. I see women after they deliver their baby and come in for postpartum visits. And I see people for annual health exams, for pregnancy, contraception, a whole host of just women's health issues, problems. And, uh, and I'm also certified as a uh, it's called perinatal mental health. I'm not a counselor, but I can prescribe medications and help connect people to services for mental health as well. So the other days, I am on call at the hospital, and I work either 12 or 24 hours at a time. And I'm there as what's called the first call provider, which means I work with physicians, but I'm the one doing most of the greeting people as they're coming in for having their babies, getting them admitted to the hospital and taking care of them in labor, and then being the one to deliver their baby and taking care of them a little postpartum. I ended up being an anthropology major, but it was for anthropology of medicine. So the big questions, and so this is, I was always asking very broad questions to like, what does healing or healthcare mean in different societies? It's not, I didn't see it as just like an antibiotic to take care of something or a surgery to take care of something. It was, what does it mean to someone to be well in their society, in their culture, in their family, in their personal viewpoint in life. So, and then I stumbled onto midwifery because I lived with a few midwives in Vermont, and they were very inspiring. And I went to some home births, and then I realized that I didn't really want to be a midwife in home birth. It felt a little too risky. So then I became a nurse, and all the while I was bringing that midwifery, I mean, sorry, the anthropology with me because it was all about transitions. I was very excited to like greet people when they were making major transitions in life. And so pregnancy is a very big transition because whether it's their first baby or their second or third, it's a change. And when people are in transitions, they're very ripe for making changes in their life. Maybe it's quitting smoking. Maybe it's realizing that they, in terms of becoming a parent, that they need to look at some of the things in their life that are stumbling blocks and learning. And so as a midwife, it's kind of like the word for midwife is with woman. And so we kind of like go on a journey with our clients and that's just very exciting for me. I've been a midwife for over 30 years, and it's still very exciting for me to go on that journey with folks. So I was working at a local, by this time I had moved to New Mexico in 87, and I was working as a nurse in labor and delivery. And I was working with a variety of physicians, and there was one physician who I just felt like he didn't go the extra mile, and I kept thinking I could do this better. And it was when I made that big leap to say that I could do this better, I could be more personable, I could not only just be there for the physical aspect of delivering the baby, but I could offer a different kind of care. And that was the first, it was like the big leap that I could do this. And then a program came along. At that point in time, the University of New Mexico didn't have a midwife program, but the Frontier program in Kentucky, which was a historic, one of the first midwifery programs, and they actually set up in New Mexico for a very short period of time and gave way to the UNM program. But I was perfectly at the right time there to go from nurse to nurse midwife. In high school, I didn't know I wanted to be a midwife then at all. I think I was more geared towards biology. My father is a biologist, and I graduated early from high school and went into an environmental studies program there. But the education I had in high school and also early college was a very broad, it was an alternative high school for the last couple of years, and then also alternative college where there was where you really blended a lot of different areas. So you might be taking a course in sociology, but you're also delving into some history or some biology. And in high school, I think that some of the best things I did was just to find mentors, to find teachers that really inspired, and to spend extra time and ask questions that even goes beyond just what we were, the curriculum, and to, just to continue to seek out people that inspire. I think that's one of my lessons from high school. Follow your inspiration, because sometimes we go along in school and we have to do certain things that are part of the curriculum, but to try to keep your eye on something that just really lights a fire in you, and it may not be something you can see right in front of you, but if you just keep holding it out, it'll be there and you can work towards that goal. But just to stay really inspired, because it'll rub off on people, and it'll keep your life, your career path, going for a long time, even if that inspiration changes. So